This episode of Healthcare Triage is sponsored by Ground News, a new website and app that lets you compare how major events are being covered by a variety of media outlets. Head to ground.news/healthcaretriage or click the link in the description to download the free app. The effects of implementing Medicare for all would be numerous, including a potential effect on wages. Currently, millions of Americans get their health insurance through their employers, and many economists believe that wages are lower to offset that cost. Research suggests that in some cases, wages might rise when employer healthcare costs are reduced. That's the topic of this week's Healthcare Triage. Special thanks to Austin Frack, from whose Upshot column this episode was adapted. Hidden in the larger past debate over Medicare for all was a fundamental economic question. Who pays for work-based health insurance? For the 157 million Americans who get health insurance through their work or through the job of a spouse or parent, the answer may seem obvious, evident right on the pay stubs. Employers pay most of it, and workers pay some. In 2019, work-based coverage per person cost $7,188, with employees directly contributing 18% on average. Family coverage cost $20,576, of which employees paid about 30%. But what seems obvious isn't always what's correct. Regardless of what's on your pay stubs, many health economists believe that your employer's contribution towards health insurance comes out of your wages. So would Medicare for all cause wages to rise if employers have to spend less on benefits? Research suggests the answer is yes, with the caveat that it might not be matched dollar for everyone. The precise relationship depends on the nature of the labor market, which varies across markets and jobs. The economic theory that explains why employees foot the bill for health insurance is this: whether it's in dollars or health insurance, what matters to workers is the total value of their compensation for work. There are other workplace benefits, but none anywhere near as costly and important as wages and health insurance. In a competitive and fluid labor market, where there are many similar employers and workers and little difficulty in hiring or switching jobs, an employer that tries to undercut the prevailing market rate risks losing workers to competitors. Likewise, a worker who demands more could well be passed over for another who will accept the prevailing rate for total compensation. One option that was under Senator Bernie Sanders' Medicare for All plan during the last election would have reduced employer spending on health insurance by $9,000 per employee and would have raised taxes on the wealthy. Senator Elizabeth Warren's plan would have also raised taxes on the wealthy, but would have aimed to tax employers an amount intended to match what they would have spent on healthcare anyway. In a Democratic debate in December of 2019, Mr. Sanders differed from President Joe Biden in saying wages would rise if employers were no longer involved with health benefits. Many Americans are skeptical of this. In a Kaiser Family Foundation poll, 63% said their wages would stay the same if their employers' healthcare costs fell. Some studies in economics support the theory that employers trade off health insurance premium for wages almost dollar for dollar. A study from the Southern Economics Journal examined salary and benefits data from the New York Department of Education in the 1970s. Controlling for confounding factors like teaching experience, education, school budget, and other benefits, the study found that a dollar increase in the value of health benefits was associated with an 83-cent reduction in salary on average. But other studies of public sector employees find little to no evidence of a comparable trade-off between wages and health insurance premiums. One, in the Journal of Health Economics and based on data from over 6,000 school districts, found that a dollar increase in benefits was associated with a reduction in wages and salaries of only 15 cents. Another, from the same journal, used national surveys of public sector workers and employers' data and produced similar findings. Why might premium and wage changes not perfectly offset each other in public sector jobs? One possibility is unionization, which is more likely in the public than in the private sector. Unionized workers are better able to bargain for higher compensation than individual workers who are more easily let go and replaced with others. Negotiated contracts could end up with health insurance benefits increasing without offsetting reductions in salary. And what about the private sector? Here, many studies suggest closer to a one-to-one trade-off between workplace health insurance premiums and wages. Some of these studies focused on specific benefits, like maternity care, or on different populations, like those with obesity, finding that their higher costs to employers are offset by lower wages. Other studies examined broader markets. A study in the Journal of Health Economics looked at what happened in Massachusetts after it enacted an employer health insurance mandate in 2006. it found that the $6,100 annual employer cost of coverage was nearly perfectly offset by lower wages. Another study in the Journal of Labor Economics found that married women with workplace health insurance coverage have wages that are lower by about the same amount as their employers pay for that coverage, relative to married women with no such coverage option. Nevertheless, even in the private sector, there are exceptions, with some studies finding that healthcare costs for workers are not always perfectly offset by wages. Just as in the public sector, this could happen if the labor market is not perfectly competitive. For instance, to the extent workers cannot find other jobs, they may be forced to pay more for their benefits, either through rising premiums without more pay to compensate for it, or through greater cost sharing. In other cases, some firms may incur higher healthcare costs that they cannot pass along to workers without losing them to competitors. Much of the increase in healthcare costs is due to price growth, perhaps without a commensurate increase in the benefits of care. The wage issue is just one of the trade-offs that would be involved with Medicare for All. There are also healthy debates on how much taxes would rise and how much costs would fall. Ultimately, someone would have to pay for Medicare for All, so not everyone would be better off. But to the extent the cost of health insurance is shifted away from employers and to the federal government under Medicare for All, it seems wages would rise, at least for some people. Healthcare Triage strives to keep you up to date on health information ranging from public policy and healthcare systems to health misperceptions and even just debunking bad information. The way we consume news is a big part of how we perceive these issues. The landscape can be confusing, with conflicting stories, recommendations, and, depending on the news source, just outright misinformation. If you're interested in seeing how a single news story is being covered across the political spectrum, you might be interested in checking out Ground News. Ground News is a new website and app that lets you compare how major events are being covered. It shows you the bias of some media outlets so you can see how they're framing an issue compared to other news organizations. See every side of every news story by going to ground.news/healthcaretriage or click the link in the description to download the free app. Hey, did you enjoy this episode? You might enjoy this previous episode on cost-sharing pitfalls. We'd appreciate it if you'd like that video down below, subscribe to the channel, and consider going to patreon.com/healthcaretriage where you can help support the show, even during a global pandemic. We'd like to especially thank our research associates, James Glasgow and Joe Sevitz, and of course, our Surgeon Admiral Sam.